with this, it's certainly an area of clinical practice that I've changed how I support my endo women. So if you saw me 10 years ago, my endo treatment is very different to how it is now. And what I'm realizing more and more is that I think that endo is, as I've mentioned, a multi-systemic disorder. I don't think it's just gynecological anymore. I think it is the interplay between the reproductive system and the immune system. And that interface of that interplay directly occurs in the peritoneal fluid. So the peritoneal fluid, for our listeners, is the fluid that surrounds all of your abdominal area. So it's the fluid that washes over your digestive organs, your reproductive organs, your bladder, etc. And that peritoneal fluid contains very important components of your immune system. And if the peritoneal fluid itself has any imbalance, it causes disease and disharmony. And we now know that endometriosis travels and is developed by imbalances in the peritoneal fluid. So what I now understand as well is that the peritoneal fluid can harbor infections. And it can also be a response to an infection that might be in the digestive system or that might be in the bladder that may then aggravate or amplify or cause the endometriosis. And so what I'm realizing now is that, system-wide infections, be it viruses, bacteria, parasites, whatever, are exacerbating and sometimes causing the endometriosis. So what I'm doing now with women is investigating their immune response a lot more intensely. And that test that I alluded to earlier, that cytokine panel, looking at specific cytokines, which for listeners is basically just looking at the immune system in a very detailed manner. And I'm looking at it and seeing imbalances or fluctuations in those levels can be quite a diagnostic tool for me to go, okay, that person is actually dealing with a parasite or that person is dealing with an underlying virus. That's where my treatment needs to focus. And by restabilizing the immune system, I can pretty much always get endometriosis under control now.